I am a nurse informaticist.
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 I am nurse informaticist.
Nursing Informatics.
Nursing Informatics.
I am a nurse informaticist.
I am a nurse informaticist.
I am Cinderella Guillermo. I am a nurse informaticist. And these are the benefits of nursing informatics.
For the benefit number 1, nursing informatics informs and influences IT systems. It's their blend of clinical and technical knowledge and experience that make them perfect liaison between the clinical and technical communities. One of the early contributions of nursing informatics was to help move healthcare away from paper forms and turn it into electronic documentation, which helped health worker to access medical record and provide convenience, especially when patient is in emergency situation. Today, a nurse's standardized notes are immediately available to physicians and other caregivers through electronic health record systems. Workflow and decision are more informed and efficient. These electronic health record vendors are acquired a double-barreled secret weapon because nurse informaticists recommend the most practical layout for forms and reports and the best processes for electronic medication administration. They prevent electronic health record mutiny because they can predict clinician reactions to technically efficient but clinically clumsy workflow and shape electronic health record that avoid these poor workflows. Nursing informatics specialists are trilingual. They understand the clinical language of efficient patient care. They translate knowledge and clinician feedback into technical language of business, analysts, and programmers. They communicate clinical and technical matters with administrative leadership. It's not simple to speak effectively with clinical, technical, and administrative people. Still, nursing informatics specialists are qualified and have proven to be indispensable to the development of superior healthcare information technology system.
Benefit number 2. Nursing Informatics leverages evidence-based clinical best practices. The 4 main points are: number 1, researching clinical nursing practices outside of their own experiences. So, nurses have a responsibility in some way to contribute to the development of the profession's knowledge through research. A new generation of nurse researchers is helping to improve patient care. The evidence-based interventions we learn can improve patient outcomes, help to provide high-quality care, reduce costs, and eliminate the practices that have become obsolete or are not effective. Number 2, finding evidence to prove which clinical practices are best. When enough research evidence is available, the practice should be guided by research evidence in conjunction with clinical expertise and patient values. Determining appropriateness of the evidence for use in practice are accelerated when the knowledge-based information is readily available. Number 3, influencing the design of clinical systems to support and promote the best evidence-based practices and workflows. A good workflow will help accomplish those goals in a timely manner, leading to care that is delivered more consistently, reliably, safely, and in compliance with standards of practice. And the last one is training other nurses to use clinical IT systems. Nurses are integrated into the field of IT automatically, so they should be able to deal with it successfully to improve quality of care outcome.
Benefit number 3. Nursing informatics generates stronger nurse training in clinical IT system. Nursing informatics specialists are well suited to teach other nurses how to get the full benefits of this system. Nurse informaticists help design and create those very systems. They can explain, build in interoperability and behind-the-scenes interfaces to other clinical systems in language that's easily understood by nurses. So much like any other informatics discipline, it incorporates both computer science and information science into whatever scientific field that seeks to potentially organize and enhance its ability to improve on its information or technology base. That being said, informatics can basically show up just about anywhere, and it kinda does these days, especially in the healthcare scene with nearly profession and specialty is beginning to look into their own respective informatics components. Because of the high tendency of nursing informatics specialists to deal with information systems of not just nursing-related matters but also of those pertaining to healthcare in general. There is also a related high tendency for practitioners of this specialty to be in some form of management function. The ability to understand all aspects of nursing science, nursing information science, and even potential nursing technology is a feat to be had, which is why those decreasingly rare few who have this tend to lead more than actually doing stuff themselves.
The fourth benefit of nursing informatics is that it leverages IT investments. Every health facility, starting from single physician practice to the large academic medical centers, invests a significant amount of their budget on essential health information technology products and services. This includes patient care systems like the PACS and electronic medical record systems, or even the EHR or EMR. They also use communication technologies like pagers and secure messaging systems. Nurse informaticists help get maximum value from these investments in at least three ways. First, they ensure that systems are designed to support effective patient care workflows, which is better explained in the first benefit. Second is that they help train other nurses to use IT effectively, which is also explained in the third benefit. And then finally, they apply advanced analytic strategies to develop predictive models. As an example of predictive models, consider Texas Health Resources in Dallas-Fort Worth, which is located in South America. Their informatics nurses use analytics tools to identify the risk of sepsis, risk of readmission, and potential benefit from palliative care.
Benefit number 5. Nursing informatics contributes unique wisdom to clinical care that is acquired only through a deep understanding of both clinical practice and data analysis. Informatics nurse specialists work with leadership regarding regulatory and quality initiatives and governance of technology implemented and changed. Informatics nurse specialists identify the key areas where studies tells us problems arise, such as inadequate discharge education, a patient doesn't have a support at home, poor hearing or sight, or being on multiple medications. Informatics nurse specialists take those variables and identify how and wherein the system we should alert a nurse that this is a possible red flag and give her the elements of a plan to decrease the risk of readmit. Informatics nurse specialists explain to the technical and application team what we need the system to do. Nurse informaticist understands data analysis and nursing practice. They immediately know which trends are worth analyzing and which anomalies are significant enough to escalate. Lastly, Nursing informaticists determines other measures include return on investment analysis, patient preference or needs, and infection control data. How's the need for technology addressed? Let's say a high rate of medication errors is identified. Analysis how and why the errors are occurring must be conducted. The research can include collecting data from other facilities in the area to determine if the same problem exists elsewhere. Following data collection, the findings are presented to a review board. A plan to improve the problem is implemented, such as the use of barcodes, scanners. Data collection continues to determine if implementation is successful. The most important piece of implementation is presentation of the evidence to staff to identify how the change will improve the day-to-day actions of nurses.
Benefit number 6 of nursing informatics. Nursing informatics enriches the evolving healthcare delivery system. These benefit advances in healthcare technology launch new options for healthcare delivery. Nurse informatics specialists are helping ensure these new options are beneficial to both patients and clinicians. Two examples are developments in communication technology and remote healthcare, known as the telehealth. Regarding the communication technology, vendors are using smartphones to transform the way communication in nursing happens. Meanwhile, the growing field of telehealth, patients are receiving education and self-management training, automatically storing and forwarding medical data, and seeing their providers.
Benefit number 7. Nursing informatics improve patient care, patient safety, and patient outcomes. The more generalized field of healthcare informatics focuses mainly on administrative issues, whereas nursing informatics focuses on patient care. In fact, the substance of first 6 benefits of nursing informatics is all about improving care, safety, and outcome. For our patient, it is more efficient electronic health records, better IT system, research and application of clinical best practices, training of other nurses, analytics-based predictive model, new avenues for patient education, support for telehealth technology, fewer medical error, more informed clinical decision-making, shorter hospital length or stay, lower admission and readmission rates, better self-management.
Electronic medical record or the electronic health record. Examples of EHR are eHatid, Sirius MD, and the Blue EHR. As of 2018, the following hospitals are using these: the Medical City, Makati Medical Center, and St. Luke's Medical Center. As of 2019, the proposed National eHealth System and Services Act was approved by the House Committee in Health in the Philippines. They mandated DOH to lead the act and create Interagency and Multi-Sectoral National eHealth Steering Committee or the PNEHSS. According to DOH, Institute of the Philippine Culture or the IPC of the Ateneo de Manila University developed eHatid, used in 42 local government in the Philippines. March 2019, Cagayan de Oro signed a conform granting limited license for Ihatid LGU EMR system. Justiniano Arborja General Hospital, or the JRG PH, telemedicine or the teleconsultation. As of March 2020, Department of Health loads telehealth provider and companies providing consultation since the start of COVID-19 outbreak, with Consulta MD and Medify as their partner. They are still searching for other providers who are willing to participate.
I am a nurse informaticist, and we are the group 4.